Geeta Sharma, and I am an OBGYN. I've also done a subspecialty in maternal fetal medicine. I went to medical school at Cornell, and I stayed there for medical school, residency, and my high-risk fellowship. Then I was at Columbia, and then I was asked to come back to Cornell. I was at Cornell most recently until July 2018. I left there to join this wonderful practice, an all-women's practice that is fantastic, and I was lucky to be asked, and I'm really enjoying being able to be in this practice, and I started here in September. In my old practice, we had electronic health records, and it seemed like it was an amazing thing to have. With a young child, I was able to answer patients' questions electronically, have access to their phone numbers and call them with results that had come back after hours. And I thought that it was really wonderful, but it also, in terms of establishing balance, led to a really big imbalance. It sort of was, work never stopped, and I get that as a doctor. It's not just a career, it's a lifestyle, and you're really committed to your patients. But the challenging thing is that the amount of work that was put on the electronic health record never stopped, and it was a big challenge in terms of balancing how much work was required to maintain the electronic health records. And there was a thought that they really weren't designed to be very user-friendly for the physician. There was a lot of data entry that we had to do. It didn't really interface well with the patients. Patients signed up for access to their charts, but when we would send records, oftentimes they wouldn't get their comment back on their lab results, and I would get a message back a few days later that they never saw the message, and then you'd have to call them and create a lot of phone tag. So there was a lot of redundancy in the work that was being done, so it wasn't a great efficient use of time, and that sort of spilled into other aspects of my life where you can't ignore the needs of your patient, and what ends up being ignored is sort of the other aspects of your life, and that wasn't something that was really well sustainable when you can't really chronically be fatigued and perform at your best. I have. Our inpatient, and in my previous job, the inpatient electronic records were different than the outpatient records, and there was no communication. And in fact, the emergency room is a prime example. We would send a patient in who we had a phone conversation. We would put in an entire conversation with what was going on and what was the urgent issue, and have a phone call with the attending in the emergency room, and they would say, well, we don't have access to the outpatient record, and so they would never be able to see the notes and what led up to why they needed to be seen in the emergency room. And then there would be an inpatient chart, and so the inpatient chart and the outpatient chart didn't communicate, and we would have to sort of bridge that gap, which again is again, not complaining about the work, but just more and more layers of that just kind of take away from really being able to do your job of taking care of patients most effectively and efficiently. And you also want to make sure that communication is easy amongst providers, and that we're providing the information seamlessly for the patient's behalf as well. So that was challenging when the inpatient and the outpatient didn't communicate. Where I am now, I'm very happy that the inpatient and outpatient can communicate with each other. But actually in the practice that I'm in right now, they don't have an electronic health record, and some of it is a bit, not just of the cost, but electronic health records have led to a lot of physician burnout in terms of the amount of work they take in terms of charting, and that can be problematic. And I've seen doctors that have left. When I was a resident, there was a group of doctors that were the first group that had the electronic health records, and half of that group left because it became very difficult to manage their very busy practices. and the demands of the electronic health records. Obviously, there have been some improvements, and there still needs to be more improvements in making them more user-friendly and keeping doctors off the computer and being able to actually spend time face-to-face with patients and be able to interact with patients and do more doctoring than charting, which is still important as a mode of communication, but can't be the only aspect of healthcare. I think being able to dictate notes would be very helpful, and I know that there are sort of add-on things that can happen. I think having an interface with the patient where some of the patient's symptoms or history could be input by the patient and not have to be put on a piece of paper and then inputted by the doctor, where you're basically doing a lot of data entry for each visit. That would be really helpful as a time saver. And of course, the patient would input it on a tablet, and the doctor would be able to go over it with the patient. But just the physical, maneuvering and clicking also led to a lot of, my colleagues and myself, like having some fatigue of just your elbow and using the mouse, repeatedly, hundreds and hundreds of times a day. And I know I have a colleague who actually has a mouse tracker that counts the number of, sort of like miles her mouse has moved from just the amount of charting that happens. So it would be nice to have also, for research purposes, to have fields that could be searched if you wanted to look at a particular outcome. We're seeing that women in pregnancy who've had high blood pressure could be at risk for other issues, cardiovascular disease, later on in life, but also not so later on in life, even, a few months to a few years after delivery. And it would be really nice with this new information and new research to be able to do a search and look at those patients, not just for research purposes, but also for their benefit, and say, this was something that you had at that time, but now that we know more, it would be great to get you in contact with a cardiologist or a family practice, a primary care physician, to let them know about that aspect of your pregnancy health that would have an impact on your health now. So those would be really helpful tools. Or when certain medications are recalled, you want to make sure that you can, or they, say we have to, advise a warning or such, to know all the patients that you've prescribed this medication for, so that you can give them information about that.
Have you faced any issues in electronic health record systems with searching for information or researching information?
Yes, it hasn't been something that you could do on your own. It was something that you would have to go through a lengthy process, and that lengthy process, on top of the other demands of what are bigger priorities for patients that are actually having issues, or the routine follow-ups that you must get done in a timely fashion, the charting that must be done in a timely fashion, kind of preclude you from chasing after, okay, let me do these big searches, and more for research purposes, and that kind of would go by the wayside. But it would be helpful to be able to do those in a more streamlined, efficient manner. Well, I think that it's great that there's an interface with the patient, and I think that's something that wasn't there before in the experience that I've had, except for messaging. And I think that messaging as the only aspect was a little harmful, because patients are so used to other messaging tools that seem more instantaneous. And since that was the only way that they could interface, it felt like they would want to get a response right away. Whereas here, when they're part of creating their chart and they can see that it has other layers, that it's not just a messaging tool, it's really their data, I think that's really helpful. And I think, as you described, that there are layers of encryption, and that it's decentralized, that it's really more direct to, I hate to say consumer, because I think patients are people and not just consumers, but I feel like there's a bit more that can be done when it's more direct, and patients have a more involved stake in creating their own charts, but also accessing their charts, and also controlling how their data is shared or not shared.